Welcome to the Myrna Method live stream. I'm registered dietitian Myrna Haag, where I try to bring you impactful nutrition information that can significantly change your life. In this video, we're going to talk about exercise. Now, not really nutrition, but it does take good nutrition to get some really good exercise. But what we're going to highlight is how certain types of exercise done a certain way can significantly increase your health by having all these physiological benefits happen. So I want to go through what those benefits are, and then most importantly, zero in on the type of exercise it takes to get these heightened benefits for your health. So Sam, if you'll take it down, let's get this thing rolling. So when I think about muscle moves, I don't always think about what it's doing to our the immunity or your metabolism. We're really thinking about how buffed we're going to be, right? How we're going to look in that bathing suit or whatever that outfit is we're planning to get into for some big function. And we don't really tie it to what it's doing for longevity or for our health or for immunity. And I'm going to tell you, it's one of the best anti-aging remedies we've got going. I'm 67. I'm looking closer to 70 than I like to think about. And one of the major impacts that I can do to reverse aging is knowing how to exercise. Because just getting off the couch and walking, by the way, that's great. And that's a good start. But it's not going to really get the full benefits like what I'm going to tell you in this video. So let's talk about the benefits first. And then let's talk about the exercise you needed to get there. Muscle immunity. So the actual movement of muscles a particular way for a particular intensity for a particular duration releases chemicals. And these myokine chemicals, they're like protein-like hormones. They affect immune cells, bone cells, brain cells. They can affect almost every single tissue in the body. And we're just now learning more and more about them. And I think the biggest benefit is what they're doing with anti-inflammatory immune cells. So exercise trigger these myokines that get in there and they make our macrophages, certain immune cells, interleukin 6, interleukin 10, interleukin 15, all these immune cells, like who really cares about interleukin what? What I'm trying to stress here is these are major anti-inflammatory immune cells, and when they're circulating, you have less inflammation. It also helps create killer cells, which are what fight infections. So when you're in an exercise program and you're working an exercise program with a certain length of time, a certain duration, you're going to start having less infections. Not because the body's just getting stronger. Yes, the body is getting stronger, but it actually releases chemicals that are taking part in improving our immune cells. And also in the American Journal of Clinical Nutrition, you're thinking, okay, where do we find studies on exercise in the Journal of Nutrition? Well, reason being is because they're really trying to pinpoint for dietitians how important it is to not alter that muscle metabolism in any way, because it's the muscle metabolism, which we're going to talk about, the mitochondria, the powerhouse of the cell, that is so important for the prevention of common pathological conditions, chronic diseases. These are implicated in bodies that are sedentary because the bodies don't have that extra armor that exercise brings. And then why is it in the Journal of Medicine, in the Journal of Nutrition? Because it's really trying to stress the fact you better feed the muscles right. I'm not going to talk about that in this video, but as a dietitian, I'm really hyped on making sure my patients are getting adequate protein. And yes, carbohydrates. Protein and carbohydrates are what muscles need to function optimally. So that's what they're trying to stress, bringing point that it's not just about having a thin body, it's about having a muscular body. And also exercise induces M2 macrophages that accelerate wound healing. A lot of studies on that. These are those chemicals that actually help with your body heal. And the body it's not just about getting a nick in the body, healing an actual wound, surface wound, but we have a lot of wound healing even within the body. Our epithelial cells, a lot of things that can get damaged that we don't see inside. And exercise induces the immune cells that repair that. The other thing that exercise does is it affects brain chemicals. Dopamine makes you feel good. Thank God, right? Because some of the workouts you have to do to get the added benefit, you almost better have the little feel good afterwards. Well, that's what exercise can do. It creates little dopamine effect that makes you feel good after you do it. It also releases pain relievers. These little catecholamines, little steroids, these cortisols. So if you wake up and you're just feeling cranky, you know what I mean? Like you just don't feel good, your back hurts, your ankle hurts. There's always something hurting as you're getting older. And the last thing you're thinking about is going out there and exercising. And what I'm telling you, it's one of the best things you can do. So even if you are in some type of pain, getting out there and moving will release chemicals that relieve the pain. The other thing that it does is it helps modify the cognitive impairment. It helps reduce dementia risk. A lot of people used to say, well, it's because of all the blood flow, and it actually helps with the lymph circulation. But it's actually even more than that. It's some of these hormones and these chemicals that are released during exercise, and also it lowers the inflammation. So all of this in combination, studies have shown that aerobic exercise specifically, which we're going to talk about what that is, because like I said, a certain type of exercise for a certain amount, duration, certain intensity does all of this. So especially with reducing cognitive impairment. And then, of course, we have some other studies that talk about these chemicals that help with bone health. Some of these observations that they found is that these chemicals that you get from exercising, secrete osteogenic factors. These are bone repairing chemicals. The other thing is it is your metabolism. Your muscle is your metabolism because exercise increases mitochondria. These are the powerhouse of the cell, and you have the highest number, the highest volume of mitochondria is in your muscle. And you have the most control to increase the powerhouse of the cell. And just the name of it, powerhouse of the cell, ought to, imply how important it is. And they can grow in number and size just after 6 weeks of the right kind of exercise. So not only does it help with immunity, cognitive, bone, but it also is your human metabolism. And a lot of times we think of metabolism just to be about calories in, calories out. Higher metabolism means I can eat more and not gain weight. I'm going to burn more fat. Yes, that's true. Higher metabolism does do that. But metabolism is so tied in to this mitochondria that it really talks about metabolic function in general, because so many things are tied into this powerhouse. So having more of these is highly instrumental because it means you're going to function better overall. Metabolic means everything, metabolizing everything, cells, enzymes, everything in your body that is going to have some type of makeup is going to need some type of metabolic action. And exercise helps improve that. It also helps with, and I'm going to get to this big discovery because I don't think a lot of people even understand what it can do to the gut microbiome. And I always say the gut microbiome is the new pioneer I think it's a new frontier, pioneering part of medicine, because we are every day learning how these gut bacteria, how this environment in the gut is so instrumental to the rest of our health in our body, because the chemicals your gut makes through food, through exercise, and even your brain thoughts can affect the diversity and the gut bacteria species. And why is this important? Because the bacteria in the gut, the good and the bad, travel, and the bad ones don't work out so well for you, because a lot of these bad bacteria can cause damage, can cause injury. Oh yeah, but if you're exercising, of course, you're going to be better off for fixing those, right? But having a really messed up gut does help your health, does, cause damage to your health overall. But exercising can actually increase the diversity and increase the gut bacteria. So it's not just about food. And in this particular study, it says exercise, the gut microbiome, and gastrointestinal diseases, the therapeutic impact and molecular mechanisms. And this study talks about how through observation, they have found that cardiorespiratory fitness, cardiovascular fitness, aerobic fitness, which I'm going to talk about, is what is related to certain bacterial species and metabolite production. And this is what's been implicated in several disease states, not only from the good side where it can repair, but also some of these bad bacteria that can cause damage. But what exercise does is cardiorespiratory fitness, exercising at a certain intensity for a certain duration, can actually increase the good bacteria and also other certain metabolites. They can produce health benefiting chemicals in the gut that travel to other areas of the body and improve function. So let's talk about, I'm going to come back to this slide where I really talk about how skeletal muscle crosstalk among all the other parts of the body. Let's talk about right now what type of exercise does this. The exercise that triggers this biochemistry. Now, any type of movement is positive. So if you're sitting on your couch and just getting off the couch and walking, just going for a leisure walk is major improvement, right? Because you're increasing your circulatory system. There's so much benefit there. It does help the lymph system. But you're not going to get the added benefit that I just referred to at that heightened level until you exercise just a little bit different, or I should just say a little more intense. The aerobic capacity. This is the body's ability to exchange oxygen. So that means that you have to go out there and do a certain type of fitness where you're, I'm not saying breathing heavy, but your body and your heart is pumping at such a rate, which we're going to talk about what that rate is, that you are getting all the benefits of the immunity, the gut microbiome, the gut health, the reduced risk of dementia, all of these heightened functions. If you can just work your body in this respiratory aerobic capacity, if your muscles can work in this zone, you get that added benefit. And then the other form of biochemical trigger is actually muscle mass, actually increasing the size of the muscle. And the only way that's happening is going to be with intensity. That high intensity, the shorter durations, you got it, folks, lifting weights. So if you're out there lifting weights and you're just sort of leisurely doing it, you're not going to get quite the intensity building as when you're taking the muscle, short durations to maximum effort. So let's talk about the aerobic capacity, because for me, this is the one that I think has the highest impact in really causing great benefit, really preventing so many diseases, especially metabolic diseases, because metabolic, just the word there, lets you know that it's going to be involving the mitochondria. Metabolic diseases typically are type 2 diabetes, dementia, obesity, cardiovascular disease. Those are typically, when we talk about metabolic diseases, those are usually the ones we're referring to. So how do you build this aerobic muscle capacity? How long do I have to do it for, and what intensity? Well, we measure it with the heart rate, because that's the only way we know that the heart is beaten the way it should be beaten and you're exchanging oxygen at the rate you should be to get this added health benefit. So there's a formula. I want to explain it to you. You can write it down. I'll give you an example. You take 220 minus your age, minus your resting heart rate. So maybe you get up in the morning, first thing you do, take your heart rate, see what it is for a minute. So you take your resting heart rate, the number of beats per minute, and you're going to multiply that by 0.55. That's about the lowest we can go. Because if you go 0.5 or 0.4, you're not going to be working quite at the level of intensity you need to get this oxygen exchange going at that certain rate to release all these chemicals that are going to give you this big added benefit. That's the minimum, 0.55. So let's do an example. So we have it here. I'm just going to write it out. So if you have your phone nearby, you can be doing these numbers yourself. You take 220. Let's say you're 50 years old. And let's say you have a resting heart rate of 70 beats per minute. Then you're going to get your number. I already did the math on that. That's 100. You're going to multiply that by 0.55. And then what you're going to get, and then you're going to add back your 70 beats per minute, your resting heart rate, and you're going to come up with 125. What does that mean? That means you want your heart rate to be at 125 beats per minute, okay? It'll range between 0.55 and 0.75. So if you go anywhere from 125 to 15 beats, so maybe 125 to, in this case, 140. Anything over 140, then you're pushing a little higher intensity. Not that that's so bad, but you're going to get the highest level of aerobic muscle capacity when your body is working in a respiratory state. And that's what this is. And you've got to be at the minimum amount. So that means somebody who's 50 years old and has a resting pulse of 70, they want to make sure that when they're exercising, they're at 125 beats per minute. And then they have to do it for a certain time. That's why a game of pickleball is great. I mean, it's fun. It's exercise. You're burning calories. But it may not really qualify for aerobic muscle capacity, what they consider cardiovascular respiratory fitness, because you have to sustain it. Which means you, in the CDC, Center for Disease Control, states that we want a minimum of 30 minutes 5 times a week, which is really 150 minutes a week. They would like for you to do this cardiovascular fitness, this respiratory fitness, this aerobic fitness, this muscle capacity improving fitness, exchanging that oxygen, measuring it through beats per minute. They want 150 minutes a week minimum. And they'd like to have you do less more often, so they're saying try to do at least 30 minutes 5 times a week. Or maybe you could do 45 minutes 3 times a week. But that's where you're going to get this muscle capacity aerobic fitness that's going to really boost your immunity, increase the wound healing, and some of the added benefits from all of these chemicals that circulate because you're pushing your body at a certain rate. Now, in one of the podcasts I did a couple weeks ago, I talked about in a previous stream that fasting, because of the autophagy, which I'll explain a little bit in this video, increases your body's ability to clean out waste in the cell. That's what autophagy is. And exercise can have the same effect. So I kind of want to bring it back in this video. But when we talk about aerobic exercise being the best way to do this, with autophagy, and what autophagy is, it's your body's removing of cellular trash. Now, your body does autophagy anyways, and I said this in the last video I did. It's a natural, listen, if your body didn't clean itself, you would be a big trash can. Of course it does. But what they're saying is that if you can fast, and they were using fasting for 24 hours and 72 hours, your body is going through starvation, that it actually ups the ante on autophagy. It heightens its ability to clean a cell. Now, my whole take on that is, okay, I understand if you're in a bad way, you're 150 pounds overweight, you're struggling. Okay, autophagy, maybe through fasting, could be of some benefit. But even then, as a dietitian, I'm trying to figure out a better way, because ideally, it's still going to put you in a catabolic state. When you don't eat for 3 or 4 days, yes, you might get some added autophagy, but you're also going to get some muscle loss. You're not in an anabolic state. And let me tell you what, at 67 years old, headed towards that 70 faster than I'd like to think, the last thing I want to be doing at my age is be eating away any muscle. And I wouldn't recommend it for any age, but especially as you're aging, because it's so doggone hard to get it back. So autophagy can also be done at the same level as 72 hours of fasting without the catabolic state or losing muscle, if you can do aerobic capacity for a minimum of 50 minutes, 50 to 60 minutes. Then the cell clicks into a hyper state of cellular cleaning, which, by the way, the body does it anyways. You get a good night's sleep, you exercise, your body does autophagy, but it can do it a little better and in a heightened level when you're working this aerobic capacity for 50 minutes at this continuous heart rate. And that would mean, again, try to get 150 minutes a week. So it could be, maybe you do it 2 times a week, but I would prefer 3 times a week, 45 minutes to 50 minutes. That's the minimum. And that also covers the CDC for overall respiratory fitness and getting some of the other added benefits. So when we look at the mitochondria and how it's built, and we look at overall this crosstalk between exercise and every other cell in the body, it's highly, highly critical to your overall health to bring in that respiratory aerobic fitness, try to get that heart rate up to that level, or you can do perceived exertion on a scale of 1 to 10. A lot of times you can be on medications, blood pressure medications that may lower the heart rate. So perceived exertion means if you're out there, you don't want to be too breathy where you can't talk, but on a scale of 1 to 10, 1 being easy, 10 being hard, you want to be out there walking at about a level 6. That's going to give you just that little heightened intensity to get your body working in a more aerobic state. So bottom line, what I wanted to really make sure this video talked about was the importance of understanding that exercise done at a certain intensity, certain duration, this aerobic exercise, this cardiorespiratory fitness, and also making sure that you have the muscle mass, that you're building good muscle, can have high benefits in so many other areas. You have less infection. Overall, it heightens your health. So, Sammy, how are we doing? Any questions? Okay. So remember, you can always get me on my membership where I talk about how to live your life at your leanest and healthiest, and also the book on Amazon, Why Your Diets Fail, and the science that really works. Until next time, Sam, we're good. Don't forget to like and subscribe. And as always, exercise and diet make the biggest impact in your health.
Oh, wait. Actually, you just got one right
Oh!
before I ended it. Hold on.
Bring him back. Bring him back.
Oh, very close.
All right, Sammy, save the day. All right. Does exercise also help the microbiome in your mouth and throat? Well, exercise, I know that the microbiome in your mouth and throat is related to the microbiome in your gut. You clean out your gut, and periodontal disease improves. So the answer to that question, because there's that linkage, would be absolutely. Because what's going on in your mouth is what's going on in your gut. Good question, by the way.
All good?
All right, yeah.
All right, till next